Welcome to the Equestrian Experience, a show where we talk about what happens behind the rosettes and what we've tried so that you don't have to. In a world first, we and our guests openly share what we know from our extensive equestrian experience. This includes our exclusive access to global experts such as high performance, national vets, coaches, farriers, and even brands. If you're new here, consider subscribing. We're your hosts, Amanda Ross and Bex Mason, and today we're talking to equine vet and founder of Empowering Equine Education, Dr. Lizzie McCready. Welcome, Lizzie. Thank you so much for joining us on the pod.
Thank you so much for having me. I'm a big fan of the show.
Okay. And Bex, welcome from freezing cold UK. I think you may be surrounded by snow and pretty much snowed in.
Oh yeah, absolutely. -4 here. We've had a dump of snow last night, so yeah, loving the English winter already, but looking forward to speaking to you, Lizzie. Got loads that we can give our listeners today. So just to get started, Lizzie, do you want to just tell us a little bit more about yourself?
Absolutely. So I've got a pretty traditional vet story, but with a bit of a plot twist thrown in there. So I graduated from the Royal Vet College back in 2016, started my career out in ambulatory practice, traveling around different parts of England as a locum vet, and then quickly learned that I wanted to fast track my learning. So I got stuck in working at a fantastic equine hospital in Kent, did an internship there, and off the back of that, realized that I wanted to pair my profession with my love of traveling. So I bought a one-way ticket to Melbourne in 2018. And have been there ever since. Although right now I'm with you, Bex, in the UK in the -4 snow while I'm on a 4-month kind of sabbatical back home to see family.
Oh,
when I landed in Melbourne, I was working in a really busy ambulatory practice and also worked towards my certificate in veterinary acupuncture at the same time. But it was in 2021 that my career had a little bit of a shake-up. I actually herniated a disc in my lower back and was suddenly forced to take time away. In some ways, it was really upsetting because burnout is really common in young vets in particular. But the injury gifted me with something that not a lot of vets have, which is time. Now, having dealt with lots of emergencies, more emergencies than I've had cups of tea, which being British is probably quite a lot, I knew that the horse world really needed a lot more attention when it came to helping owners on the ground level dealing with these scenarios. And I was caught thinking, could I be having more of an impact than what I'm currently doing, running around at 1,000,000 miles an hour, trying to save the world one horse at a time? Mm-hmm. So I thought, well, emergencies are inevitable, and it's pretty shocking how many people don't know exactly what to do in order to help their individual horses recover and also how to really work well with vets. So I was inspired to start handing down my knowledge and expertise to the everyday owner, helping horse owners all over the world and really helping to support the vet industry from the ground up. So that's where the business Empowering Equine Education was born.
That sounds really, really interesting. So firstly, because I'm Melbourne as well, whereabouts are you based in Melbourne?
So I'm just east, so I'm over in the basin near the Dandenongs.
Ah, I see. Okay, so super horsey over the Yarra Valley side.
Over the valley, yeah.
Yeah, okay. So your business is Empowering Equine Education. Mm-hmm. And so tell us a little bit more about it. Describe to us exactly what that entails, because I agree with you. Like, as a horse owner, it's one thing to say learn the steps of an emergency, but when you're actually in it with your own horse, I can imagine just completely forgetting and having absolutely no useful thoughts come to my head whatsoever.
Go into panic mode and meltdown mode.
Yeah, totally.
Exactly, ladies. Like, what actually happens is when we are encountering like a stressful situation, the brain blood flow shifts. So we go from being able to think logically, all of a sudden just going into fight or flight, and all of our like sensible thought processes just shut down. So it's no wonder that when we do find ourselves with a horse and they've got a gushing wound coming from the leg, or potentially they're down thrashing on the floor with colic, all of a sudden we think, God, where the hell do I start? And the reason why vets are able to stay as cool as a cucumber is because we've had so much training. We have been flexing that emergency muscle for years and years and years before we actually get out onto the road and have to start implementing our skills. So it really comes down to this saying that I really love, which is like, we don't rise to the occasion, which is something that I think we tend to really lean on and get caught out by. In fact, we fall to the level of our training. So we have to just have a sit back and think, okay, realistically, what is my training? What have I got to fall back on so that I don't find myself feeling unprepared if I do find myself in an emergency situation? And that's exactly where the business comes in, because I'm providing that training and I'm providing that teacher to owners and other equine professionals, so we can really bridge that gap between the vet world and the owner world, because it's huge. Like, I look back on myself. Before I went to vet school, I'd had 15 years of horse experience growing up around them, but I knew only a pinch of salt compared to what I know now. So I really want to start leveling the playing field a little bit.
I love that saying, actually. We use that with our equestrian team with the high performance. And we had a guy come in from the military, and he said exactly the same thing. He said there is no point, rising to the occasion, because if you practice and you train before that, it all comes to you naturally and you don't have to think about it. You just act on it. So.
Absolutely. I think it was a Navy SEAL who actually came up with the quote to begin with.
So where was the turning point for you, Lizzie?
The turning point
for when you wanted to become a vet? Was there a turning point?
I was about 5 when I wanted to be a vet. My mum turned around to me and was like, "Do you want to grow up and be a vet, Lizzie?" And I was like, yes. It was all I ever knew I wanted to do, which left me with a lot of drive and a lot of focus going the whole way through school. And I knew I'd always wanted to work with horses because I love the fact that they're performance animals. Dogs and cats are amazing. I love them too. But horses, there's extra element to it. They mean so much more to us than just, I'm taking them for a walk and they're just a part of my fur family. Like, there's the performance side as well, which adds an additional monetary value to what our horses are worth to us as well. So we need to really be focusing on how to enhance that longevity and make sure we're looking after them, and we're not going to end up having to get in a tricky situation later down the line.
So what are the most important steps a horse owner should take? So where do we start with your program?
So I would always say that you need to start by, let's say that you find yourself in the paddock and your horse has got some blood running down the leg. You don't quite know where it's coming from. So the first thing I really want you to do is breathe, because again, what we want to do is we want to try and lower your own stress levels so you can put your thinking hat on. And also, the owner's stress levels directly impact the horse's stress levels. So if you're there panicking, you're only going to make your horse worry even more. So just try and take a couple of deep, slow breaths, and then having a plan of action or some form of order of operations is invaluable. So this is actually where I love to start teaching owners about the how to act frameworks. This is my 3-step fail-safe framework that you can lean on no matter what emergency you find yourself in. And ACT stands for assess, communicate, and treat. So a lot of owners fall into the trap where they see something bad, they panic, they pick up the phone to the vet, and then they're just rushing all these words down the phone, but not really giving anything of any value. So if you can actually just take a second to assess your horse first, like ideally doing the full horse health assessment is fantastic. This will allow you to gather all your information. First of all, decide if you need the vet and how urgent it might be. And then then means when you get onto that second step, which is communicate, you can relay really valuable information to your vet. Then you can work together. They might be able to give you some specific advice to help you in the moment. They might be able to tell you, listen, actually, I think this can wait 24 hours until we're in normal clinic hours and you don't need to pay an after hours fee. Or they'll say, okay, actually, this is something really significant. I'm going to bump you up to the top of my emergency list. And this is particularly important when we're dealing with horses that have got severe colic that actually might need surgical attention. So once you've done those first 2 steps, you've assessed and you've communicated, then you can get stuck into treating. I know lots of people, the only time I would go straight into treat is maybe if I had a wound that was losing a lot of blood. So if it's pumping and squirting, that's a sign that there's been some form of arterial bleed and you want to stop that as soon as possible. So treating is just you're going to be taking action with your emergency response skill set. So if the horse has got colic, you might take food away and hand walk them. But if there's a wound, you're going to want to flush and clean it and bandage it appropriately.
Okay. So, Lizzie, what vital signs should everybody be aware of to be able to communicate to the vet? So, for example, if you come down there and you see that whatever it is, the horse is not quite right, are there a list of things that would be really, really helpful? Let's say we're dealing with a suspected colic.
Absolutely. So I think everyone at the bare bones should be able to do heart rate with a stethoscope, ideally. There are ways you can collect a heart rate without one, for instance, by counting the digital pulse, but a lot of owners find that quite challenging. Or potentially there's a artery that runs under the jaw that you can use, but a stethoscope is the gold standard. Along with taking a respiratory rate, so that's your horse's breathing rate, and you actually want to do that from a distance, Amanda. And you want to do that first when you're just observing the horse. So I always look at them from a distance and I look what their demeanor or their character is. Are they dull or are they bright? Are they depressed? And then I count their respiratory rate, because as soon as you go up to them and you start fiddling around with your stethoscope and your thermometer, then you're going to start disrupting their normal breathing pattern. So it's important to get that at the start.
That's a really good point.
And then obviously temperature. Temperature is a really important one. So if you're dealing with a horse that's colic and their temperature is normal, that's going to tell the vet a lot. But if it's abnormal, if they've got a temperature more than 38.5, we're most likely going to think they've either got a peritonitis or the fact that the colic is that severe that they're starting to get a bit of gut content leaking out and causing a widespread infection within the body. So those three, your TPR, temperature, pulse, respiration, are key. But I teach my owners how to also do digital pulses, look at the mucous membranes, which are the gums. I can tell you a lot of information, and also count the capillary refill time. So we also measure that on the gums. Listening to gut sounds is amazing. Taking those digital pulses as well can then provide you with a really full picture of what you might be dealing with.
And do you have any tips for getting the right temperature? Because I actually ended up buying a thermometer through my vet, because I found that I'd go and buy, say, God, I like thermometers everywhere from the chemist. But after a while, I could use, 3 different thermometers and I'd get a different reading from each one.
Oh, yeah, it can be really frustrating. So I like the big thermometers, because first of all, actually taking your horse's temperature is one of the most dangerous things you'll do as an owner. You are right in the kick zone, and some horses really don't like it. So it's good to know how to do it safely. And I find using the larger ones are just easier. You definitely want to stay away from the old school mercury ones, because if that happens to snap or you drop it on the floor in the yard, that's bad news. So the fast digital ones are great. And for the technique, first of all, safety-wise, you always want to be standing on the side of the horse, putting all your pressure on one leg and really leaning around so that you're not directly behind them. And then make sure you're going in deep enough. That's one thing I see a lot of owners shy away from. So you want to be going in, I'd say, at least 1.5 inches, and try and stick to the side of the rectal wall as well, because that's going to give you a more accurate reading. If you are finding that it's coming back really low, so let's say it's in the 36s, or your readings are really inconsistent, it might be that there's a ball of manure stuck in the rectum, and it might be that you're actually going into that as opposed to taking an accurate temperature. So that's why sticking to the wall or the side can really, really help. If you're getting a value that it's making you think, oh, that's a bit unusual, try and find another thermometer just to do a bit of a quality control check with.
Okay, yep, that sounds really good, because I know that's one thing that I always find a little bit unnerving, is that I'm trying to get that right temperature, and what if I end up missing something because my thermometer isn't taking the right reading?
Completely. And one thing I will actually encourage all my owners to do as part of the training that I run, Amanda, is that I get them to do the horse health assessment for 5 consecutive days on their horse when they're normal, because as a vet we spend the first 2 years of vet school just learning about normal animals, so that you can then tell the difference. And I don't want you only checking your horse's vitals for the first time when they're sick, because you then don't have anything to reference it to. So it's always worthwhile going out, checking your horse's vitals when they are well and healthy, so that you have that baseline, so that then you know if there's like a small discrepancy, like, oh, my horse normally sits in 37s, like the low 37s, all of a sudden he's up at 38.2. That's not technically a temperature, because that would be 38.5, but still that would be enough to raise my eyebrows and think, okay, there's probably something going on here.
That is actually the best bit of information. That is such a great tip. And I like thinking back to the times when I've got to know my horses quite well. I've been doing a lot of heart rate training with the eventers, and I got to know walk, trot, and canter, and what their heart rates should normally be. And the purpose for that was that I knew the minute the heart rate monitor went on, if it wasn't quite right, then they could be not feeling quite 100% that day. And it was a really good indicator either not to do the training or not to push them as hard, or to monitor it afterwards. So, that's a great tip for their general health.
Yeah, that's fantastic. That's really, really interesting. And one thing I try to stress all the time, Amanda, is that you, as the owners, you guys know your horses 10 times better than the vets will. So yes, we're coming in and we've got all the experience with regards to veterinary illness and disease and all those processes, but you're the ones who know your horses day in, day out. And I'm going to listen to you as an owner. So the higher quality conversation that we can have, if we're talking about heart rates and vitals, the better, because then we can actually work as a team.
Yeah, no, that sounds really, really interesting. Now, talking of your courses, what type of courses do you do, and how long do they take to go through to participate in?
Yeah, so the course that I run is there's one main online program and it's called the Equine Emergency Response Training. It's a certified course. It runs for 8 weeks online. It's only 2 to 3 hours a week worth of time that you need to complete it. So it can fit in around all your horse duties and for those of you that are working full time as well. And it's a real combination. So I've got pre-recorded videos that are on there. So these are all filmed with a professional videographer up in Sydney. So skills such as how to do your horse health assessment, how to do all your bandaging, including complex techniques like hocks and knees, because I see a lot of owners running into trouble with those, which is something we can go into in a second. And also things like medication techniques. What are you going to do if the vet hands you a bag of eye drops or a penicillin bottle and says, here you go, I'll see you in a week? It's how do you do those with confidence? Because it can be scary as an owner having to inject your horse for the first time, twice a day in the muscle with 30 mils of liquid.
Oh, yeah, that's really hard. I have actually sent one around the paddock with a reaction to penicillin, and it was, it was the last drop, the last shot of 2 bottles.
Yeah.
And I've never seen anything like it. And I remember ringing the vet and said, the horse just kind of cantered off across the paddock randomly and ran over his feed bin. And I thought, that's really weird. And then I rang the vet and I said, there's something going wrong. He said, get out of the paddock.
Yes.
And it'll either be dead or alive in 5 minutes and there's nothing you can do about it. Oh, my God. It was terrifying. I mean, it was okay. But, that must be terrifying, for any owner having to deal with that if you're not aware that that's a possibility.
Completely. And to be fair, we don't tend to go into much detail with owners about what the serious consequences of incorrect or inadvertently incorrect administration of penicillin can be. Like if it just comes into contact with a drop of blood, it's going to send this horse into a crazy neurological reaction. And I'm just so glad you were in a paddock, Amanda, because if you were in a confined space, and I have seen this happen with horses that are in stables, they have that same energy rush and they're going round and round and round and round, but they're stuck in a box and you might be in there with them. So that's why it's really important to know how to do these things safely and just having that understanding beforehand of if something does go wrong, okay, at least I know why it's happening, because that time of you having to call the vet, imagine if they hadn't picked up, you then would have been left alone feeling really confused and probably overwhelmed about what was going on.
Yeah, absolutely. God, your course sounds like everybody should do it.
Well, I look at the human world, right? And we have human first aid, and heaven forbid someone was walking down the street and there was someone choking and there wasn't someone within a 5-meter vicinity that didn't know how to do the Heimlich maneuver. But it's like in the horse world, horses are far more injury prone and there are far fewer people who actually know how to fix things on the ground level. And I just really hope that we can start seeing this as like a new industry standard that we can start embodying so that the horses are really getting the best care possible. And especially for those of us that are working as professionals or working in the industry on big yards, then being able to enact these skills at that level and making sure that we have at least one person who's qualified within a training facility would be amazing.
Oh, I couldn't agree more. What do you think is the most common? Is there a most common ailment that you think all horse owners should have a little bit of an inkling or have an automatic reaction to know what to do in those first steps?
Yeah, absolutely. So I'd probably say there's a handful of those really most common ones. I'd say colic is the top condition that as a vet I see absolutely every day. And colic can be life-threatening. Yes, some of the cases will just resolve medically out in the field, but some of them might end up actually needing to go to surgery, and they can come on really, really quickly. They can catch you off guard. They can happen to a horse of any age. And it is one of the conditions that you can get really heavily involved in as an owner, because you being able to take that initial assessment of the horse, then also being able to monitor them while the vet isn't there is key. One thing I really noticed as I went from working in the hospital to out on the road was that in the hospital, if a horse has got colic, we're checking them every 1 to 4 hours. Whereas out on the road, you might not see your vet for 12 or 24 hours maybe. So that's a huge amount of time that the horse is going without really being monitored, apart from you just seeing what you can see from the outside, but that's just the tip of the iceberg. So imagine if as an owner, instead of you just standing back and just having to wait, you can actually be doing those 1 to 4 hourly checks yourself. And if you can then pick up anything that then changes, you can then report that back to the vet. And then if you guys have to change your course, or if you decide that you do need to put the horse on the float and take them to a hospital, you can, and you're doing it in time, because colic is really time sensitive. If the horse gets to a point where the gut's twisted and too much of it dies or it starts to leak, really there's not much we can do as a vet to help them.
Oh God, I know. There's one of those nightmares, isn't it? You always think that it's just something mild and that they'll get over it, because having to put them in the float, I've heard of all sorts of different stories. I don't want to have to relive one of those.
Yeah, completely. And I love really teaching people about colic surgery. Like we should do a full episode on colic at some point, because there's so much to share about it. But again, owners being aware of what the steps are, what the financial implications are, maybe having a plan in the back of your mind of, okay, what would I do if I was encountered with this situation? Like we had a beautiful 8-year-old event mare that was off for rehab with an annular ligament injury, and the day she was meant to come back into work, she got really severe, so acute colic. She was so sore, Amanda, we couldn't even get her on the box to take her to hospital. And it was just
really,
yeah, being caught in that scenario where you don't feel like you can do anything is the worst. And sometimes there's nothing you can do to physically help them, but at least if you've got the skills to start getting involved, and at least you're being hands-on instead of just bystanding, I think that's enough to put any owner at ease and just give you that self-assurance that you need.
Oh, absolutely. And can you help also suggest to people, or I mean, I'm sure you can, the kind of kit that we should have at home, so that we're as best prepared as possible to be able to do these first aid steps?
Absolutely. So I provide everyone with a first response kit checklist, because I think it's really important that you have everything, and that's something I can easily help hook your listeners up to if they'd like a copy of that as well. Now, I tend to separate my kit out into a couple of different sections. So you have your assessment tools at the top. So it's really worthwhile having your stethoscope, hoof testers if you've been trained how to use them, which are going to help you pick up any foot pain, your thermometer as well. And then you're really moving into your wound cleaning items. That's going to be your chlorhexidine. That's my firm favorite. Iodine.
Yep, got that.
Yeah, iodine I try and steer away from. It's actually very harsh on wounds. It's really good for foot problems. Yes, if you've got a penetration injury that's gone in through the bottom of the foot like a nail, if the vet's come out and seen it, because please don't go pulling a nail out before the vet has actually seen it, unless the horse is at risk of driving it deeper into the foot. Iodine's good in those instances, but actually for wounds on the body, chlorhexidine is the best, along with some form of saline. So I love owners to carry the sterile saline bags that you can literally cut the top off and then use to flush your wounds. But you can also get the saline sachets that you can mix with water at home and then use that to clean the wound. Because you really should.
They must be much bigger than the human eye saline.
Yes,
packs.
yeah. So they're about a litre.
How big are they?
Yeah, about a litre.
Oh, the big ones. Okay.
Yeah, they're great. So they're normally used actually for IV drips. So if you have a friend that's in the paramedic field, you can actually talk to them, because as soon as they go out of date for human use, they tend to just give them away. So they're fantastic to have on hand for horse owners. Yeah. So wounds, eye injuries, anything that needs flushing, they're great for.
Really interesting, because I know there's a lot of these things that I do have in my first aid kit, but there's also little bits that you use and then you forget to replace, and then when it comes to it you go, oh my gosh, I really need that. So it's remembering to replenish as well, isn't it?
Yes, that's why I love having like a stock intake. That's why I have the checklist. So you can, and I always make sure that my sheets are laminated, so you can use a Sharpie pen. You can wipe it off when you don't need it, but then essentially it's there to reuse. And you tick off what you have, and then when you take something out, you make sure that you highlight that you've taken it out so that you know to restock it, because it's really easy just to leave our kit bundled in the corner of a tack room gathering dust, and then all of a sudden when you do need to go into it, you're like, God, I swear I had a poultice in here 6 months ago. So just trying to really be prepared and just be aware of what you have sitting where. So the saline's fantastic, and then you go on to also your bandaging materials. So your bandaging is always going to consist of multiple layers. Please don't just have vet wrap in there. That should never go straight on the skin. So you're going to want like a variety of dressings, a nice soft cotton underlayer. So I love soft band, which Bex is something I used in the UK. Too. Yeah, I used it in the UK a lot. Came down to Australia and didn't see it anywhere. So I've brought it back into my repertoire, and I'm spreading the soft band love around the country.
I love soft band.
It's amazing. It's so great.
Is it like a reel of kind of not cotton wool, but like polyester sort that you can kind of bandage on, and you pull it apart, couldn't you?
Yes, exactly. So it's really, really thin, and they tend to be kind of in 10 centimetre high rolls, and they must only be like a couple of millimetres thin. And I put the dressing on and then wrap the soft band around. And what this does is it helps keep the dressing really secure in place. You know what it's like if you're trying to put a dressing on and then a thick cotton wool layer and the horse moves, you can say goodbye to the dressing. It's going to end up on the floor. But the soft band will stay in place. Plus you can do these really clever tricks with it, like called a figure of 8 technique. So use that over the knees and over the hocks, which then help reduce pressure sores on those really sensitive points, for instance, on the back of the knee where the accessory carpal bone is, or on the point of the hock, or on the inside of the hock where the medial malleolus is. So those are areas that we need to be really conscious of when we are bandaging, and try to do everything in order to prevent pressure sores, because they can end up then being another problem that you've got to deal with on top of the wound that you're trying to fix.
And being from both ends of the world, what are the differences, or are there differences between, you know, illnesses or injury or some of the equipment that you use in the UK versus Australia?
Yes, well, I guess the majority of horse emergencies are worldwide. Horses tend not to discriminate too much based on postcode, but there has
I was going to say, are the ones in England more accident prone? I would like to say they are.
They're questionable all over. So, there are so many times I've just thought, how? Like, I can't even figure out how this has happened. All I know is that I've got to find a way to deal with it, you know? But there are definitely some differences between the two. I'd probably say snake bites is the most significant difference between Australia and the UK. I can remember my first weekend on call as an Australian vet. My boss rings me up. He's like, "Yeah, sorry, better tell you about snake bites." And I was like, "Oh my god, is this real?" So just knowing how to handle those, because obviously those can also present as colic signs, where the horse might be walking like they're on hot coals. They might have spontaneous bleeding coming from the eyes and the nose. And again, things like snake bites are quite time sensitive, so it's worthwhile knowing how to deal with those as an owner, just in case you're waiting an hour or two for your vet to get there. And then I'd probably also say sand colic.
Oh, that's awful.
Is probably more prevalent in Australia than the UK. We still do get it in the UK, but obviously that's down to the sandy soil that horses are grazing on. Now, if they ingest that sandy soil, it sits in the gut and irritates the gut lining. So I'd say we tend to see more of that in Australia. And then the last one is probably the difference in toxic plants. So in the UK, we're really familiar with ragwort. Obviously, that can damage the liver and cause neurological signs for horses ingesting over a long period of time. So I've seen that more commonly in the UK. But down in Oz, we see a lot more stringholds. So this is when the horses eat flatweed or capeweed, and that plant contains a neurotoxin, and that then causes an exaggerated movement of the hind legs, and it almost looks like they're trying to kick their belly while they're walking. So
that's so interesting, because over here in the UK, Lizzie, I mean, we have horses, I'm sure, well, you have to probably correct me on this one, but we have horses when they have string halt, it's just the way that they move. It's I thought it was just a mechanical thing, but obviously in Australia it's because they've been ingesting this poisonous plant, but in England, so can you explain the differences for that for me?
Yes, absolutely. So there's Australian string halt, which is the one that tends to classically be due to the plants. But then there is also more so like an idiopathic string halt that does occur, that could be more likely due to trauma or some kind of acute inflammation, which again is affecting those nerves that run down the back of the leg. So the ones that we do see in the UK, they will tend to resolve more spontaneously. I have seen a case of Australian string halt or true string halt in the UK as well, but the vets I used to work with are like, nah, surely not. It can't be, because it's that rare. Whereas in Australia, the plant one is just far more common.
That's really interesting. I didn't know that.
Well, well, as you know, at the moment, we are having a really cold snap in England. And we've got loads of snow. I'm not having to be able to work the horses properly. So in comparison with Australia and the UK, and with the hot and the cold, what are the different illnesses you see with the affect them during with the temperature?
Yeah, absolutely. Well, I guess in the UK, we're really familiar with mud fever. That's one that we have.
Oh, so am I. Don't worry, I'm in Melbourne. It's raining right now. I know. I'm freezing as well.
I know. It has been really bad in Melbourne recently. And again, a lot of people don't know how to deal with it. Mud fever itself isn't really an emergency, but if the mud fever gets bad enough, the infection from the outside of the body can get into the skin and suddenly travel up the legs. So we get this full-blown cellulitis. Now, that itself is an emergency. That can go from 0 to 100 literally overnight. And if we don't get on top of that infection, it can have life-changing implications for the horse. So that is directly affected to the weather. But I'd probably say that both Australia and the UK, because we get those extreme ends of temperature, so it gets really hot in the summers in Australia, and right now if we're going through a cold snap in the UK, horses get far more prone to getting impaction colic, because any time there is some form of sudden change in environment or sudden changes in management, so for us Bex, all of a sudden the horses can't eat grass because it's covered in snow or frost. We've got to provide them with extra hay. We might actually be you're keeping them in. We can't exercise them because the arenas are frozen over. They're probably going to be drinking less water because the water's going to be icy cold. So all of those factors in together, paired with what we might see in Australia, which is if it gets really hot, all of a sudden they're sweating more, they're losing more electrolytes, they're walking around less because they're standing under the trees, and the pasture isn't as great because it's all burnt off. Those collected in together are going to make the horse more likely to have their gut slow down, they'll get an impaction, and then what you're left with are colic signs. So something to be really aware of no matter which country you're in, anytime you go through some form of extreme change.
And obviously colic is basically just it's all over the board, it's everywhere, isn't it?
Yes. Yeah, absolutely. We should definitely do a full episode on colic because it's one of the most passionate topics I love sharing about, especially going all the way through to what to experience at hospital and beyond, because a lot of people get very scared about colic, and rightly so. It can be life-threatening. And there are a lot of myths. One myth I'd love to debunk on the podcast right here and now is please don't feed your horse beer if they've got colic. I get that a lot in Australia. Yeah, should I just give my horse beer? And I think in the UK they're more prone to giving them Guinness. And it's like, if you think that that's going to get into your horse's stomach, you're laughing. Plus, also horses have like meters and meters and meters of gastrointestinal tract. So it's very unlikely it's going to get from the stomach to actually where the problem is. More likely you're just going to annoy your horse or potentially even have that fluid going into the lungs. Or if you're putting anything into your horse's mouth, there's a chance it's actually going to go down the windpipe and into the lungs. So I see this a lot with choke. Obviously, horses, when they're choking, it's not the same as when humans have choke. Like when we choke, it's in our windpipe and we can't breathe. When a horse chokes, it's in their esophagus, which is their food pipe. So they can breathe, but they still look really, really distressed, and it can require veterinary attention. But please don't stick a hose pipe in your horse's mouth. I see people doing that on occasion because, again, that water can just end up going down into the lungs, and you're going to end up with a really severe lung infection or a pneumonia, which is going to be 10 times worse than the choke was to begin with. Oh my God.
This is so many things.
It's a wormhole, isn't it?
Well, tell us, look, on that note, whereabouts can our followers and us find your course? Can you give us a bit of a link?
Yes, absolutely. So the best way to connect with me is on Facebook. So either by getting in touch with my personal profile, which is Lizzie McCready, or the business page, which is Empowering Equine Education. Through my social media, I then advertise the course on a really regular basis. But if you are interested, the best thing to do is just reach out to me. We can have a quick conversation. I love to know every owner that is coming through the doors to find out your own backstory and exactly what you really want to achieve, because I know that everyone's got their own personal reasons for wanting to sign up. For some people, it's because they've had a really heartbreaking experience and they just want to do different the next time, just not get found in the same position. And for others, they've just got that real learning bug and they want to know everything and anything that they can. And it's a really unique opportunity because there are no other vets out there talking about this and sharing their knowledge in this way at the moment, because everyone's so bogged down in the trenches trying to take care of everyone's horses. So it's very unique in that way. But yeah, I'd say the best way is to connect with me on Facebook, and we can also probably add a couple of links into the show notes here to help.
Absolutely, of course we do. So would that be under Dr. Lizzie McCready, or do you have it under Empowering Equine Education?
Yeah, so Empowering Equine Education would be the business name, and then just my personal name. You're not allowed to use doctor on Facebook, so it's just Lizzie McCready.
Fantastic. I think this sounds like such a good idea for everybody. And when you think about it, like we say, prevention is better than cure. So rather than waiting to do the course when something's gone wrong, it's almost like buy a horse and do the course, and that way you've already got some preparation.
Completely. Yeah, absolutely, Amanda. And the thing I love about it is that it's not going to go out of fashion. And you know what? You do this once, and then you have it in your toolkit for the rest of your life. And especially those owners that have got more than one horse, you can use it on as many horses as you have, or your friends' horses. Like, you just don't know when you might be driving down the road and you see someone else that's been involved in a floating accident where the horse is suddenly stuck in the float and they're there flapping, not knowing what to do. And you can jump out of your car and be like, do you know what? I know how to handle this situation. I can take charge until the emergency services get here. So you just don't know when you might need to pull it out.
Yeah, and this would be even fantastic for, like, for example, we have so many inter-schools competitions here in Australia. For those parents that are coming into, you know, their kids that have started riding, or they're really into it, and the parents aren't horsey. Like, I think even for that'd be such a fantastic thing for them to at least have that basic knowledge. And even if they're not great with handling the horse and the kids doing it, between the family or between the pair of them, they can actually implement some of those strategies.
Completely, absolutely.
Yeah.
And one thing worth noting is that I run workshops in person. I've done them mostly in Victoria so far, and I've done kids workshops for those under 16 because you know what, the kids are amazing, and being able to teach the next generation how to care for their own horses in this way is amazing. Yeah, so the kids workshops have been great. I actually ran one over in
I just
Thailand.
love how passionate you are.
Thank you. I'm just really inspired by all the owners.
Yeah, I love how passionate you are and how much and I can see even just by the way you speak about it and the way they talk about it, I mean, how inspiring it is and how great it would be to learn more about all of these basics just with you. There's no one else doing this, and that's what's great, isn't it? You've got all these workshops coming up. So yeah, I say to our listeners, get in touch with Dr. Lizzie and learn more about this fantastic way of keeping your horses safe.
Amazing. Fantastic.
Oh, that's fantastic, Lizzie. Thank you so much for sharing your incredible ideas and your business with us. And I really hope that everybody that's listening on this episode, so I'm thinking the interschools market, anybody that's at a club and thinks that, you know, Lizzie's information would be really great to share in a club, or just sort of get together and make sure that you know, do the course, share it with each other, even if you're all existing at the same place. I just think the more people that you have that can help each other in an emergency, it just sounds like a great idea. So thank you so much for sharing all of your knowledge with us.
Absolutely. Thank you so much for both having me. And one quick thing is if anyone who's listening wants to run a workshop in their area, like I said, I've mostly done them throughout Victoria so far, but when I get back to the UK next March, I'm planning a trip around Australia to take the emergency response training on tour. So if you really want to have a one-day workshop in your area, let me know and we can get something arranged.
That sounds amazing. Okay, followers, everybody get on to Lizzie McCready on Facebook and as well as the Empowering Equine Education page. No, that's great. Oh, well, thank you so much for joining us. And this has been the Equestrian Experience with myself, Amanda Ross, my fabulous co-host, Bex Mason, and our wonderful guest, Dr. Lizzie McCready. So you can send in questions for upcoming episodes. You can enter our competitions and access all the other episodes. Be sure to visit the equestrianexperiencepodcast.com. You can also follow us at Amanda Ross Equestrian and Bex Mason SJ and find Dr. Lizzie at Equine Education. So have a great equestrian experience, and thanks, Lizzie and Bex.